Welcome back to They Don't Tell You Back Pain Edition. This is our final installation here, and we're going to be talking about the third most common cause of back pain that I see in practice, and that is actually nerve-mediated pain. This is not in the way that you would think. I think when you are commonly talking about nerve-mediated pain, people think of nerve compression at the level of the spinal cord. Here we're actually going to be talking about peripheral nerves, in particular the superior cluneal and the middle cluneal nerves. And those run right over the sacroiliac joint. So a lot of times it's either happens concurrently with sacroiliac joint dysfunction or is mimicking sacroiliac joint dysfunction. One of the ways that you can tell that this is a component of your pain is if your pain is better with rest and it's actually aggravated with movement. And the reason for that is because as the nerve travels down from the spine over the osteofibrous tunnels right over the iliac crests themselves, a lot of times what can happen is the nerve gets irritated and entrapped there in that osteofibrous tunnel. Whenever a nerve is entrapped or irritated, it actually starts to swell. We see this in laboratory models, and we see this really in practice as well. If I'm doing a physical exam on a patient, I will always palpate this area, because if the nerve is entrapped, it actually becomes swollen enough that I can palpate it with my fingers. It feels a little bit like a al dente piece of spaghetti in a very particular point on their back. And patients are always kind of amazed that I can feel their nerves. And yes, if your nerve is mad enough, I will be able to feel it. And also being able to put your thumbs and recreate a patient's pain is pretty concrete evidence that that's part of what's going on. So what do we do about nerve irritation? Typically in the allopathic model, you're going to see prescriptions for things like gabapentin and that sort of thing, which will help mask and dull nerve pain, but it really doesn't do anything to help the nerve calm down and really stop that whole process of nerve irritation and that pain signal being shot up to the brain. So what do we do? In my practice, I use a type of injection therapy called Perineural Injection Therapy, which is a buffered 5% dextrose solution, dextrose being a type of sugar that is administered with very shallow injections right over the nerve itself. And what that does is that 5% dextrose attaches to a specific receptor on the outside of the nerve called the TRPV1 receptor, which helps reset what's called the action potential or the membrane potential of that nerve, which sounds like a bunch of sciencey jibber jabber for it's kind of like hitting a reset button. When you have a computer program that has started sending the wrong message, really, you call IT and they tell you to turn it off and turn it back on again, right? That D5W or that diluted dextrose is allowing us to turn that nerve off and allow it to reboot and come back up again. When it comes back up, it stops sending that bad signal, which helps reduce the inflammation, and it really helps break that cycle that's been caused by that nerve entrapment as it's running through. This type of nerve entrapment is not isolated to the low back. It can happen in a number of places, but since we are talking about low back pain, this is the one that is the most pertinent that I see in practice. If you think this might be part of what's going on with your low back pain, or know someone in your life that has had a number of doctor's visits and really no solution to their low back pain, feel free to share this video with them and hopefully get them some answers.